are your specific plans to protect Social Security and Medicare for people like me? I'm 1.5 years from being Medicare ineligible and 3.5 years before I'm hoping to retire. Please don't just complain about what the Republicans are doing or not doing. Please outline your specific plans.
So for Social Security, the first thing is getting rid of the cap. When somebody making $170,000 a year is paying the same amount of Social Security as someone making $37 million a year. And that's what's drying it up. As for protecting Medicare, my plan for healthcare goes far beyond that. Medicare is a great program, but what I want is to join every other major country on earth and have universal healthcare for every American. And the plan to protect, the plan that I support is the one proposed by Senator Sanders, Medicare for All, which a lot of people get stuck on that word Medicare, but this is not Medicare as you know it. Medicare for All protects vision, mental health, healthcare, every woman's healthcare. And it's all paid for by the same small fee on a check that comes out. And it not only saves people money and saves small businesses money, it will save companies as big as mine that employ thousands of people money. My health insurance, my employer's part, is about $13,000 a year. With Medicare for All, they would be paying about $7,000 a year for my health care. And I would be paying about $2,000 a year less. The only people it hurts are the insurance CEOs that I feel like we've done enough for. And I don't really care if a few CEOs have to find jobs at freaking car dealerships. Medicare for All is the only option for this country. It's the only thing that is going to save our healthcare system. And it's a popular idea, not just with Democrats. Independents overwhelmingly support Medicare for All. I believe the latest percentage of Republicans that want universal health care is like 46%. It is a topic that no matter where you go, if you bring up health care, everybody knows this healthcare system is broken. I used to work in an ER, and one of the core memories that's always stuck with me is watching people leave the ER because they were told they were going to be admitted, and the doctor flat out telling them, if you go home, you're probably going to die. And then basically not caring because they were more worried about the cost of what they were going to pay than the fact that they were most likely going to die. And to me, that just goes with my same story of when I broke my foot. The doctor came into the room and said that the foot was shattered. And he said, well, basically what he said is, in his professional opinion, I broke the F out of my foot. He said we had two options, was to do surgery or just put a boot on it and hope for the best. My mom had just started a job as a custodian, so she did not have health insurance. And I was not going to have her go through the third bankruptcy of her life. So I just told him to just put the boot on it. And that's why basically when I leave this room, you'll be seeing me probably walk with a limp. And that's a choice that nobody in the richest country in the world should have to make. Healthcare, when we say healthcare is a human right, I want to see every candidate that says that follow it up with, and that's why I'll guarantee universal healthcare. Because if you don't want to guarantee universal healthcare, you don't think healthcare is a human right.